Welcome to another Wednesday with me. Now, if I sound a little hoarse, it's okay. It's sinus, but being pretty and having someone pretty with me today, it kind of goes away. Okay, so I'm gonna dive right into this. Oh, first I want to say Happy Twinkie Day. Today is National Twinkie
Oh, I didn't
Day.
know that.
So if anybody want to get me a Twinkie, hello. Um, Today I have a wonderful guest with me. You the city. She's a beautiful young woman, and her name happens to be Tiffany, like the rich store Tiffany. That's her.
Thank you, thank you.
Tiffany, welcome.
Thank you. I'm so excited to be here.
I'm glad to have you here because I had the opportunity to talk to you about the business that you were doing and stuff, or the business that you're in, which is home health care.
Correct. Yeah.
Give me an overview of what is home health.
So home health is, well, Angels Care. 'Cause I work for Angels Care. We
Okay.
are a Medicare certified company. We've been in Wichita actually for 12 years, just educating community. But home health in general is providing skilled services. So we provide a skilled nurse to come out into the home along with physical therapy. We have social worker that can come in. These are for people who maybe they're undergoing a surgery
Mm-hmm.
or they have a chronic condition. It's to help keep and maintain their independence at home with care that we provide in the
So
home.
they don't have to be in a nurse at
Have to
home.
be.
Now,
Nope.
do you go inside a nursing facility
We can.
or
We
long-term care?
so when you break it down to long-term care, we cannot go into a facility that has a long-term care. But
Memory
if
care?
we can go into memory care,
Okay.
assisted livings, independent livings,
Okay.
and then of course
They're home.
their home. So it's wherever they call home. But when we kind of talk about long-term care, that's what they call a duplicative service. So we wouldn't be able
Mm-hmm.
to provide the same skilled
The
nursing.
billing and all of
The
that gets
buildings,
involved.
yep, the billing side would be different.
So with Angel's Home, what was the need? Being that there's so many home health care, what separates Angels?
So Angels, we do provide majority of the same care as everybody else. However, what stands us apart from them is our behavioral health program.
Okay.
So we have a behavioral health program where our behavioral health nurse is specialized in care for patients who have psychiatric diagnosis. This can even fall under Alzheimer's, dementia. The approach that our behavioral health nurse has to give to those patients is just so different
Mm-hmm.
than just any regular home health
Now,
nurse.
does the behavior health nurse or that behavioral health staff go into that, like, say, memory care unit and
Mhm.
stay all day, 8 hours a day with them, or what do they do?
Nope, they don't stay all day. Basically, our nurse's role is to go in, we assess the patient, we look at behaviors, we look at medication management, we look at caregivers and give them support as well. So even if they are in a facility like a memory care unit, we can provide education to their staff
Mm-hmm.
in order to help them create a good plan of care for that patient. So
Okay.
maybe if they're having behavior issues due to, Alzheimer's and dementia, maybe that staff is not really quite familiar with that, don't know how to deal with it with that specific patient. Then our nurse works with that patient and they educate those caregivers in that facility or in the home, wherever the patient calls home, to help better deal with that and to relieve some of that stress on
Okay.
them.
So, do you deal with disease management, or what other specialty programs do you get involved in outside of behavioral and just general practice?
Yep.
Is there another program?
So we have a variety of programs. So for
Mm-hmm.
instance, our disease specialty programs, when a patient has congestive heart failure, we can go in and help them with that. They may have COPD, they may have Alzheimer's, dementia. There's a lot of different disease programs.
Mm-hmm.
For our specialty programs, that would fall under like behavioral health. We
Mm-hmm.
have take a breath program, so that can be geared towards anybody who has COPD or maybe they do have CHF because we know that heart and lungs work hand in hand
Mm-hmm.
with each
And
other.
yes.
So they can be on multiple different ones depending on their diagnosis.
How does a person, for all of our viewing audience, know someone who's in need if it's not ourselves? So, how do they contact you?
So they can contact our office. Our telephone
Mm-hmm.
number is 316-636-4000.
Mm-hmm.
We work under the direction of their provider, so we work hand in hand with their primary care provider that they might be seeing. If they have a mobile physician that's coming in, we work hand in hand with them. But we can help them, guide them on how to get that order, or we can work on it ourselves as long as they are directing
So
us to
they
do
can just
so.
call you individually and say, I
Mm-hmm.
need some help, and this
Yep.
is what's going on, and you'll go out and you'll assess the problem.
Yep, we'll talk with their doctor. We typically get some notes, kind of a background history on what kind of chronic conditions they may have.
Hmm.
As long as the doctor approves and to
Yeah.
follow, then we will get an order to go out and do the assessment.
Well, I think it's wonderful because there's certainly a need for the home health care, and with Angels providing that specialty in behavioral, and it does set you apart.
It
And
does,
so
yep.
it makes a world of difference. So to all of our viewing audiences out there, that if you are in need of care, I suggest Angel Home Health